The discussion on Finerenone usually comes during the discussion of medical management of diabetic kidney disease. So the first question will be, what are the 4 pillars of management of early diabetic kidney disease? 1. RAS inhibitors. 2. SGLT2 inhibitors. 3. Mineralocorticoid receptor antagonist. 4th, GLP-1 receptor agonist. Which is likely to be the 5th pillar? 5th pillar is REACT, R-E-A-C-T, that is renal autologous cell therapy, collecting tubuloepithelial cells from the kidney with a biopsy, and then it is multiplicated and then re-injected into the different points of the renal cortex. The trial is PROACT-1 trial. What is the mechanism of action of Finerenone? Finerenone blocks the mineralocorticoid receptor on the basolateral membrane of the principal cells of cortical collecting duct. Thus, it inhibits sodium reabsorption, producing natriuresis, potassium retention, blood pressure control, and it inhibits or blocks the pro-fibrotic and pro-inflammatory pathways of aldosterone. Now, what is the advantages over spironolactone? 1, it has no hormonal side effects like gynecomastia. 2, less hyperkalemia. 3, it is much more selective blocker of MR. It is said that it is 100 times more selective than aldosterone, and also more favorable tissue distribution. It equally distributes in the heart and kidney, whereas spironolactone is mainly distributed within the kidney only. Now, what are the landmark trials? In diabetic kidney disease, Fidelio and pooled analysis Fidelity. Non-diabetic kidney disease, FIND CKD trial. Type 1 diabetes, FINE-1 trial. Pediatric CKD, Fiona trial. And the confidence trial, simultaneously SGLT2 inhibitors plus MRI. Heart failure trials, the most important is FINARTS HF trial, then REDEFINE trial, Figaro, and their pooled analysis is FINE Heart trial. And confirmation trial is trying SGLT2 and MRA in heart failure. There is one trial going on in diabetic retinopathy, which is REFINE DR trial. What are the 5 fives in the context of Finerenone? 1, start Finerenone when potassium is less than 5. Withhold Finerenone when potassium goes to more than 5.5. Start it when GFR is more than 25. And it decreases the relative risk of end-stage kidney disease by 1 in 5 and decreases the relative risk of heart failure also by 1 in 5. What are the KDIGO recommendation on Finerenone? 1, type 2 diabetes, GFR should be more than 25. Proteinuria ACR should be more than 30. Potassium should be less than 5. And patient should be on maximum tolerated dose of RAS inhibitors.